Good afternoon, dear friends. We would like to present the film about the technique of parental administration. From the earliest history of medicine to the days of Galen, blood and other body fluids have held a mystical quality. Blood represented life and was therefore regarded as the greatest gift, and had the custom of sacrificial offerings to the deities. A few examples from the medical literature about the reliance of the parental therapy. In 1990, it was estimated that 185% of hospitalized patients in the USA needed intravenous access, and some form of intravenous fluid therapy. About 40 million patients in USA alone receive intravenous therapy annually. One of the first historical references to the parental administration of compound was in the late 15th century, when a blood transfusion from 3 young boys was given to Pope Innocent VIII, resulting in the death of all 4 individuals. The development of the hypodermic needle and the use of parenterally injected drugs in humans is first reported in the mid-19th century. By the end of this century, there was an increased interest in the use of intravenous administration of glucose and normal saline solutions. Baxter produced the first commercially prepared intravenous solution in 1931. However, parenteral products and their administration became acceptable and a mainstay in the treatment of patients in the mid-20th century. In the mid-1960s, many hospitals introduced intravenous admixture services. In the last 20 years, the era of infusion pumps and systems and improved vascular access devices has enabled parenteral therapy to extend beyond the institutional setting to clinics, ambulatory infusion centers, and home health care. He who has help has hope, and he who has hope has everything. Thank you very much.
Hello, my name is Ícaro Lima, and this is Kursk State Medical University. And I will talk about advantages of parenteral administration of medicines. These advantages are: 1. It's rapid, only with one set of action. 2. Can be used for drugs that are poorly absorbed or ineffective when given orally. 3. It bypasses first metabolism in the liver. 4. More of the drugs reaches the brain quickly, thus it has increased effect. 5. More efficient usage because the body's defenses and detoxification mechanism are bypassed. 6. It allows the medication to be absorbed into the bloodstream quickly. 7. Large amounts of the drugs can be introduced into the body. And 8. According to the mechanism of pharmacokinetics and pharmacodynamics, effect of medicines could be different, such as delayed effect. Thank you.
Hey guys, my name is Muhammad and this is Kursk State Medical University. Here today I'm gonna talk concerning the disadvantages of parenteral administration of medicine. So first of all personnel should be trained because in most cases they make a lot of mistakes. For example, finding a suitable vein is difficult when they are working with old people or young people, especially with children and those who have the disease which is obesity. Finding suitable vein to repeat injection can cause plenty of problems. For example, painful injection, and the greatest problem is the patient will have fear or hope of having any injection in the future. Mostly it occurs among children, and also the patient's vein, nerves and tissues will be damaged by untrained personnel. The next drawback is infiltration of surrounding tissues might result if personnel are not trained or if they insert incorrectly or incorrect injection and so on. It also may cause serious problems. Moreover, in the light of rapid response, toxicity can be a problem with rapid drug administration. Here in this situation, the nurse should stabilize the dose of solution or drug and control the flowing rate of this very solution or drug in order to avoid making problems, mistakes. So one more thing that everybody should remember is after injection or after injecting, the nurse should smear the place where they injected with special fluid or antibacterial drugs such as alcohol in order to prevent or protect this very place from bacteria. Otherwise, bacteria definitely will insert and make unavoidable diseases. The final disadvantages is sterility, pyrogene, testing and large volume of solvent, meaning greater cost and labor intense than any other medical procedures. From all aforementioned facts, we can deduce that the parietal administration of medicine is extremely dangerous or too risky, and in these very medical procedures impossible to use oil or insoluble preparations, and it requires special conditions, which is trained workers and special implements. Thank you.
My name is Ellen, and this is Kursk State Medical University. I would like to talk about the complications of parenteral administration of medicine. Firstly, I would like to talk about intradermal medications. If the circulation is depleted, absorption of the drug may be slow. This is a very painful procedure and is used only with small amounts of the solution. Other complications include negative result if blood doesn't appear, or if the site bleeds at the site of injection, and irritation of the skin due to large amount of the administered drug. Secondly, the subcutaneous. Subcutaneous injections are very safe. However, complications may occur if it's given incorrectly. Complications include infection, bleeding, needle breakage in the skin, and hitting the nerve. Infection may occur if a Dutch needle is used or if the skin is pinched improperly. Infiltration may happen too. This occurs when a vein is damaged, when the medication leaks into inside the tissues rather than going into the bloodstream. Other complications. Tissue is sensitive to irritation solution and large amount of the medication. And medication collecting within the tissues can cause abscess, which appear as hardness and painful lump. Intramuscular injections. It's normal to experience some discomfort after intramuscular injections. However, some symptoms may be signs of more serious complications. For example, severe pain at the site of injection, numbness, redness, warmth, swelling, drainage at the site of injection, allergic reactions, and prolonged bleeding. So it's important to give attention to tissue injury. And finally, intravenous medication. Providing medication intravenously can be potentially dangerous. An infection is possible at the injection site. Some drugs that are given as infusion over time may accidentally be given too rapidly as a flush. This may cause toxicity or damage to the vein at the site of the injection, resulting in bleeding. Phlebitis or inflammation of the vein is also a risk in this type of injection. Another risk is nerve embolism on fat. If there is air in the syringe and the line runs dry, air bubbles may enter the vein. blood clots, deep vein thrombosis, infiltration, and allergy reaction may happen too. Thank you.
Hello, my name is Akinon Bukala Chidera, and you have just watched a video about the Parenteral Administration of Medicine. God of thanks. We just want to say a big thank you to the Department of Propagetics of Internal Diseases, and I will not fail to mention that without the help of our Professor Dimitri Polyakov, this video would not have been possible. The purpose of this video is to educate current methods of providing parenteral administration of medicine, and the making of this video has encouraged teamwork. It has been educating and fun. We hope this video helps other medical students. Thank you.